Each year, the Data Spotlight is developed with guidance and the expertise from partners in the early childhood field. This year, our spotlight centered around perinatal health and well-being. The perinatal period, the time from pregnancy through 1 year after birth, is key for long-term development of the child and the well-being of the birthing parent, child, and family system. This period is a critical opportunity for providing access to concrete supports with interventions that are particularly impactful during this time. We know the foundation of child and family health and well-being starts before birth. So now I'm going to review two key data areas for context of the current landscape. And after that we'll have our first panelist discuss several longstanding and innovative opportunities for intervention, several of which are contained in the 2024 policy recommendations of the Vermont Early Childhood State Advisory Council Network. So for our first data spotlight, often those in the perinatal period experience perinatal mood and anxiety disorders, sometimes called PMADs, which are mental health conditions that develop at any time during pregnancy, after having a baby, through the year after delivery, adopting, or experiencing pregnancy or infant loss. PMADs are highly detectable and treatable, but when they're left untreated, PMADs have substantial impacts on the lives of those in the perinatal period, their families, and communities. This includes negative obstetric and non-obstetric physical health outcomes for both the birthing parent and child, productivity loss, and increased spending on social services, resulting in an estimated $36,000 per birthing parent and child in Vermont. Our second area that we're highlighting today with data is around substance use disorder during pregnancy. We know that this can have lifelong effects on the child's ability to thrive. For children born in 2021, at least one substance was used in more than 1 in 10 pregnancies. Additionally, in 2023, the Vermont Maternal Mortality Review Panel reviewed 7 perinatal deaths occurring between 2021 and 2023. All of these deaths reviewed for the time period were either from accidental overdoses or from infections resulting from intravenous drug use. Most of the accidental overdose deaths involved polysubstance use. In addition, all deaths reviewed occurred in the postpartum period and were happening in the home or in the community. A maternal mortality review panel issued multiple recommendations for the state, many of which were related to improvements in screening, support, and care coordination for those with substance use disorder. With that, I'm excited to now introduce our panel and hand the floor over to our public and private partners who work supporting those in the perinatal period, along with an individual who's here to share her lived experience of birthing, accessing services, and getting support with perinatal mood and anxiety disorders. First, we'll hear from Ilisa Stalberg, VBF's public co-chair of the State Advisory Council and the Director of Family and Child Health Division of the Vermont Department of Health. Ilisa will provide us with more information about the perinatal landscape of resources, interventions, and supports for birthing parents in Vermont. Next, we'll hear from Amy Wenger, who is a maternal child clinical nurse manager for Franklin County Home Health Agency. And lastly, we'll turn to JennRose, a Vermont parent who will be sharing her experience accessing services after the birth of her twins. So now I get the pleasure of introducing Ilisa Stalberg. Ilisa is the director of the Family and Child Health Division at the Vermont Department of Health. In this role, Ilisa provides vision and leadership for statewide family and child health initiatives. Ilisa's approach to this work combines her deep understanding of the community-based and statewide systems that collaborate to support the health of Vermont's families with her commitment to building partnerships and shared decision-making. Ilisa has been working at the Department of Health since 2010. Now I'll hand it over to Ilisa.
Thanks for having me. Just very quickly, the Division of Family and Child Health at the Health Department works across the life course to encourage optimal health and positive outcomes for all Vermonters. We support programs that provide direct services to pregnant people, children, and families and build healthy communities. We provide leadership and guidance to professionals uh, across Vermont in the areas of healthcare, early care and learning, schools, and human service organizations. And we work directly and indirectly with families by connecting them to resources, improving quality healthcare and services, and ensuring that policies and systems are developed to allow Vermonters to achieve optimal health. And we do that in great partnership with all of you. I want to first start off by thanking Building Bright Futures for highlighting perinatal health. As you just heard, this is a critical time in the family's life and presents a key opportunity to impact multiple generations and support the health and well-being of the entire family. For decades, Vermont has had some of the best perinatal outcomes in the country. We have a long history of exceptional clinical care and strong community partners. And we've prioritized the best practice programming, quality improvement, and policy approaches that support families in this critical period. You'll hear about some of these coming up, but among them is that Vermont has an extremely well-coordinated perinatal and early childhood home visiting system called Strong Families Vermont, which you'll hear a lot about in just a second. Our Dulce program, which we're incredibly proud of, is an innovative approach based in the pediatric care setting that proactively addresses social determinants of health, promotes the healthy development of infants, and provides support to parents during the critical first 6 months of life. Support delivered is a factual information support and referral system for individuals and their support systems around perinatal mood and anxiety disorders. And hopefully you all know about WIC, but our WIC program ensures vital nutrition education and access for pregnant individuals and new families, and is an incredibly important connection to a whole host of other services and supports. And then Help Me Grow Vermont and Children's Integrated Services ensure families are connected to services and supports through a coordinated and high quality system of care. We're also really excited to share a bit about Vermont's Perinatal Quality Collaborative, which has been around just for a couple of years, except that we've been doing decades-long clinical and public health integration in this space, only calling it the Perinatal Quality Collaborative for the last few years. And we've been able to implement decades worth of evidence-based practice, screening, and quality improvement to ensure high quality care for all Vermont families. In Vermont, we have a long legacy of public policy that supports perinatal people and young families, including the recently implemented postpartum Medicaid expansion, now serving families up to, or perinatal people up to 1 month postpartum. Our breast and chest feeding protections are extremely strong and critical to this period. And we have some important workplace policies that have important opportunities to advance the health and well-being of families. We are also really shifting our paradigm to have a deeper understanding of these early relationships and their lifelong impact, and how we need to lead with families at the center. And our touch points approach that we are trying to implement across the state has really helped us shift this paradigm and is having really important positive impacts. At the state, we're extremely proud of all of this work. However, as demonstrated by the data that was just presented, there is an ever-increasing factors in families' lives that threaten their health and well-being. Like most of the country in 2025, in 2024, we are faced with conditions that are making it harder and harder to be a new family. And Vermont's rate of perinatal depression and anxiety and of substance use in the perinatal period are alarming. The poverty and isolation that many families face are, especially those in rural communities, is distressing. And there's so much work more to do to address the historical and current impact of racism and other health disparities. As we know from our data from the Maternal Mortality Review Panel, there are so many risks to families that are not experienced just during pregnancy, but in that first year postpartum, and the challenges and associated isolation can be at its greatest then. Yet, on a sort of more hopeful note, the problem isn't so big, and we know what we need to do, and there are only 5,000 births in Vermont every year, and our ability to support all 5,000 families shouldn't be very difficult. We have strong partnerships and enduring partnerships, and we have the data, as evidenced by this amazing report, really to support that. So we need to work together to build a system of care that centers family voice and health equity, ensure that our systems are non-threatening and stigmatizing or further perpetuate historical harm. And we may need to make sure that our systems of care work in partnership to scaffold families throughout this important time. And as I said before, we need to continue to shift our paradigm so that we can ensure that families have everything that they need for optimal health and development. And so we really just need to invest in these initiatives that we've already know are working, like high quality healthcare, peer recovery supports, and doulas that support families through this important period. Teams that wrap around families like Dulce and community response teams and children's integrated services. And we need to attend to the social determinants of health in the context of all of these helping relationships. We really know what works, so we can make this happen. And thank you again to BBF for prioritizing this important work, and to Amy and JennRose, who are going to share really important stories, and to all of you. Thank you so much.
Thanks, Ilisa. All right, now I'm going to introduce our next panelist. Amy Wenger is a registered nurse and international board certified lactation consultant. Her passion for maternal child health work began over 20 years ago as a doula and childbirth educator. As a nurse, Amy deepened her work with birthing and lactating people, working on Vermont's largest postpartum unit in pediatric clinics, and in her current position as the maternal child clinical nurse manager at a community health home health agency. Amy is also the founder and co-executive director of the Vermont Donor Milk Center, which provides outpatient pasteurized donor human milk to infants, along with crucial lactation supports and postpartum resources. With that, I'll hand it over to Amy.
Hi there. Thank you for allowing me to speak to this wonderful group. You know, I love my job. Even on the hard days and when it breaks my heart into a million different pieces, I love what I get to be a part of. Every day, I have the opportunity to make my patients and my community feel heard, supported, connected, and cared for in a way that matters to them and their families. And I believe they matter. I believe that all pregnant and postpartum families have the right and deserve to be held by our community with continuity and compassion in a way that matches their individual needs and cultures and their values. But, you know, perspective is everything, right? And as someone who works in direct service with perinatal families of all kinds, and as a nurse leader running many different types of preventative and medical nurse home visiting programming, I've learned I have to be dedicated to using my voice to kind of challenge the status quo here in Vermont of how we invest in our perinatal people as a population, because as you heard, the societal costs of not doing so are huge. It's causing harm. And it is creating these ripples in the epigenetics of our Vermont families. And I see this in real time, almost daily. And although we cannot prevent all the illness and trauma, we can mitigate the impact by ensuring that our communities, our families, and our babies can build a life of possibility beyond demographic, despite challenges, even with all the trauma, because the evidence clearly shows that when we start by supporting parents and caregivers in a way that makes them feel heard, supported, and connected, the children benefit. And support looks different for every person that we get to care for. I know that as a provider, my job is not to fix my client and all the issues that they present with. That's an impossible ask. My clients aren't broken. They may have been dealt kind of a crap deck of life cards or have had hard challenges, but they are certainly not broken. When caring for perinatal people, I've adapted the mindset to just meet every client and their babies in a space that honors them as the expert of their story and shift the focus to their strengths, their culture, their community, their values, and their children instead of on just every single issue every time. Because we all know that a baby and in its early critical brain development, they can't wait for every challenge to be fixed. They still need to be nurtured and parented despite this, even when it feels hard. But I want everybody here today to just think for a second about a vulnerable or transitional time in your life when someone showed up for you, made you feel supported, or saw the potential in you and gave you helpful resources. How did that change your perspective or pathway forward when you were supported in a way that you could ask for help, where it was safe to fail, where your successes were seen and celebrated, where you were given the opportunity to adapt to the changes and challenges and build that resilience where you can come out on the other side and say, I did that. How powerful was that for you? As someone who works in the field of has worked in the field of maternal child health for a really long time, there's no other life cycle event where the touch point for positive change is so open than in pregnancy. But for our families with substance misuse, we sure don't make it very easy. If you've ever heard me speak before, you've heard me speak about my client, Jane, name obviously changed for privacy. Jane was my Strong Families Vermont Sustained Nurse home visiting client who lives in a very rural area in the most northern part of the state. She has a very complex and trauma-filled life and a long history of polysubstance misuse. Jane is also the mother of 4 children under the age of 9 and has had DCF involved with all of them. I also feel that it's important to say that Jane is super smart. She's a really super smart and funny human, and who, for all that life has handed to her, has a compassionate heart of gold. Jane was able to initiate and maintain her medication-assisted treatment, or MAT, with each of her pregnancies, but has consistently stopped treatment within the first year postpartum with each of her children, as she could not keep up with all the expectations of her MAT clinic and all of the 15 plus other services that she was enrolled in. And some of those services for Jane were located over 80 miles away from her house without reliable transportation. But yet her goals have always been the same: to be reunified with her kids, which unfortunately she has not been able to do yet. The amount of time and travel to just maintain her services and providers, each with their own expectations, in part has made it so difficult for Jane to continue her MAT that she just gives up and returns to use, even though she understands the consequences. She said to me, Amy, it has been so stressful and exhausting after my babies have been born. I can't keep up, and I often start missing appointments because there are so many, and I give up and accept defeat. I often must choose my babies or my recovery, and I feel guilty and awful every day that I cannot do both. So Jane and I sat down and we made a timeline of where she had to go in the first 6 weeks after her last baby was born. And we discovered that in the first 6 weeks of where she was postpartum, she had a total of 55 visits to different providers and resources to get or do what she needed. 55 visits. Just let that sink in for just a sec. Now, if you or someone you love has ever had a newborn, then you can understand just how hard it is to take a shower, let alone get out of your house for 55 different visits. But for a perinatal person with a history of substance use, especially who lives rurally, this is a reality. The current system of care is not set up to successfully support families like Jane's. It is not equitable, and our people are dying in the postpartum, and part of it could be helped. We need a huge culture shift, and it begins with a universal and continuous infrastructure that is created to support every type of pregnant and postpartum person. And that includes it includes home and community-based supports. Our current perinatal system in Vermont has wonderful providers and fantastic programs, but continues to be very siloed, anonymizing, and is a part of the greater system that is not always very pregnant or family friendly. Perinatal care happens in more places than just a hospital or clinic. And what about that postpartum time, that first year where there's no structured care at all, when families are at their most vulnerable and where we see the highest rates and most devastating morbidity and mortality occurring for both the postpartum people and their babies? Our current culture makes it feel like parents need to be the experts on day one. We also live in a state where it is hard to make ends meet. There is no consistent village of services, especially when you live in rural areas, and no paid parental leave. We have this marketed vision of perfection, and families are forced to move at this ungodly pace, make decisions based on confusing advice and pressure from social media and its influencers, where the message is, if you cannot do this with a smile on your face and feel #blessed or love every minute, then you are the worst parent ever and you are failing. Now you may be thinking, Amy, that sounds a little dramatic. Well, first of all, I'm the mother of 2 teenage boys, so I can tell you that I still have no idea what I'm doing, and I definitely do not feel #blessed every day. But not everyone has the type of support that is safe, or they are too ashamed to ask for help, because admitting out loud that you might need help or this isn't perfect for some people is harder or scarier than continuing to suffer in silence. And the fears can become debilitating. And I see this on some level with just about every parent and partner that I care for. Just a couple weeks ago, I began visiting with a first-time mom who I was seeing for lactation consultation. She's very accomplished, has a supportive partner, well-educated, and had a practically perfect pregnancy until she developed high blood pressure and preeclampsia in her 34th week. She had to have an emergency C-section birth and a subsequent NICU stay for the baby. They had been discharged home, and now this baby was losing weight. When I walked into her home, I saw a new mom who was looking pretty fried. And at the end of her sharing her very traumatic birth story with me, she stated, "Well, at least I have a healthy baby, right?" When I hear that statement, big fat red flags go off for me. Now, screening for perinatal mood and anxiety disorders is built into our home visiting practices. So I gave her an Edinburgh screen with her intake paperwork, educated her on PMADs, and guess what? Big surprise, she's screen negative. She was also pretty directive with me that she felt okay, just tired and foggy, but would not call herself depressed. Honestly, I don't think I've met many others on this earth who can mask better than a mother can. But I also respect where people are at, so I just let it be. When I visited again at the end of the week, the baby's weight was up, so this was great news. But this poor woman was obviously just wrought with anxiety. So instead of giving her another screening, I started by sitting on the floor with her amongst her laundry piles and very gently said, I've been thinking a lot about you. You had a really traumatic experience, and that must still really feel scary and overwhelming. And I just want you to know that I see you. And that was it. That's all that needed to be said. She broke down, and, I held her while she cried. And I will let you know that this does happen a lot in our line of work as home visitors. This sweet and perfectly imperfect person described how she felt like a complete and total failure, so guilty that her baby was struggling. She was also having frantic and terrible thoughts about that her daughter would stop breathing. And she hasn't been able to sleep since they brought her home from the NICU. She's just been up watching her breathe, unable to rest. But she felt if she told anyone, that they would all know that she had failed and would take her baby away. The shame she felt was palpable, her fears very real. Her partner tried to reassure her that things would get better with time. And when she last saw her provider, everything was so hectic that she never disclosed these scary thoughts and just hoped that someone would just see what she could not say. Now, luckily, all of us maternal child home visitors are armed with resources and know how to deal with this. This is a part of the practice of nurse home visiting that makes me just love what I get to do. I met her with empathy, normalized her feelings, and helped her to prioritize her needs at that moment. I also sat with her and described the way that her baby looked into her eyes with such love and attachment while she fed her. And I could tell how already bonded they were. By the time I left her home, she had a plan of care that included a referral to a perinatal mental health counselor and a community doula. We identified a person who could come and help her with the baby so she could get some sleep. I also made her OB and the pediatrician aware so they could follow up. I made sure she knew how to access her local crisis services and reassured her she is not alone. We will be her village for now. We have her back, and told her that I can see that she's doing the very best she can. This won't last forever. That's what I get to do every day. That's what we get to do every day as community health home visitors. This is just one story of how this type of support can positively impact a family. But if this baby did not have the health issues or need the lactation support, this person might have fallen through the cracks. Her story and her daughter's story will be different just because one person said, I see you, I care, and I can help you. Every person I've ever cared for as a maternal child pediatric nurse has been my teacher. And what I've learned with 100% certainty is that every single pregnant and postpartum family needs support of all kinds. The question of what kind of support is on such a spectrum that to us as nurses, it isn't important. We are ready for just about anything. How awesome would it be if we could provide the message that when any person becomes pregnant or becomes a new parent or caregiver here in Vermont, that there's an entire perinatal community ready to hold them, whoever they are, as they are, to meet their needs and make them feel heard, supported, connected, and cared for in a way that matters to them, and how this earliest intervention will set them and their children up for a lifetime of possibility. Thank you.
Thanks so much, Amy. That was really powerful. And lastly, I have the pleasure of introducing you all to JennRose Brittenham. JennRose is a service coordinator for the Community Care Network at Mental Health. She's currently working on acquiring a behavioral science degree from the Community College of Vermont. JennRose is an advocate for removing structural and social barriers. She has embodied the mindset of it takes a community and has dedicated any amount of free time she has available to the service of her community. Now we get to hear her story of her lived experience birthing in Vermont. Jen.
Thank you. Hi, I'm JennRose Brittenham. I'm a local mother, and this issue hits close to home because I suffered from PMAD myself and know firsthand the struggles of many new moms are facing here in Vermont. It is my goal to raise awareness and create meaningful change. First, I do want to note that I believe help or support should begin at the first stages of pregnancy. Even if you're looking at the easiest, healthiest, smoothest pregnancy, a major change is happening in the person's body. Changes that range from physical, emotional, mental, and even personal societal pressures and fears are occurring. So help from the very beginning of a pregnancy is vital for short and long-term success for Vermont families. My personal experience is that I moved with my husband and 2 small children to Vermont in 2021, and very soon after was blessed with a twin pregnancy. It was a surprise, and I had a great deal of anxiety and fears. I was scared health-wise due to previous health issues while pregnant. I was scared of how this will change our family dynamic. I was scared of having to reset back to the newborn stage ×2. And I had hopefully 9 months to figure all of that out. We had our boy-girl twins at 35 weeks with minor issues overall. And once we were home, I was surprised to have a nurse from the VNA come to the house to check on the twins. She came to check on their growth and overall health because they were premature, and to check on me as well. Being new to Vermont and a mother of 2 newborns and 2 toddlers, there is a feeling of isolation, especially in the newborn stage. And so it was a relief to be able to talk to someone who understood my struggles, problem solve with me, someone that I could ask questions to and be given advice and resources. Now she came once a month to check on the twins, and it did eventually turn into more for me than for my twins. They were growing and healthy babies overall, and it became a life source for me. I mean, it kept me on a healthy track. My nurse would set goals with me, even helped during that major formula shortage to find resources and local places that carried the specific brand I needed. I believe that the nurse knew I was struggling with PMAD probably before I did. And when I hit a wall and really had to admit just how bad it was, the nurse did refer me to Rutland Mental Health and Rutland County Parent-Child Center. I knew at this point with these resources, I needed to take initiative to make the calls, schedule meetings, and participate to bring the change I wanted for my family. I became part of the Strong Families of Vermont program, which was able to send all 4 of my children to daycare through the week so that I could work on myself. I received a case manager from through RCPCC and got the kiddos into services with CIS, Child Integrative Services. We got a family therapist through Rutland Mental Health, and I took full advantage of the opportunities that were sent my way. I did a class called Mother's Therapy through Rutland Mental Health, took a parenting class done by RCPCC that was hosted by a local Wonder Feet Kids Museum here, and they actually had babysitting and dinner during the meetings. It was perfect. Sadly, that currently is not running. I did a support group for spirited children and a parenting class called Circle of Security, all through Rutland Mental Health, and parent-child interactive therapy as well, PCIT. We started as a family going to more community events that were hosted by these organizations, including Climb Out of the Darkness. Started volunteering and helping with these organizations. And it did take some time. I believe I was on a waiting list for a while, started personal therapy. And 1 month into that, I stated to my therapist that I would like to look getting back into school. And next thing I knew, I was researching how many credits it would take to earn a degree at CCV. And I got enrolled in summer and fall classes to work towards a degree in behavioral sciences. Thanks to the amazing people in organizations, it was just such a positive experience that I knew I wanted to help others as well. So to recap, I had my twins back in September 2021. And as a struggling mother, I started to actively participate in bettering myself with the help of these organizations in September 22. So it took a full year for me to admit that I was struggling and to actually start looking into resources. Now it's been a year and 4 months, and I am currently working on the developmental team as a service care coordinator with CCN and Rutland Mental Health. And I'm on the PTO at my child's school. I'm about to become a board member for RCPCC, and I am on the path to graduating this semester from CCV. I have become an active community member, and I can confidently say a more consciously patient, playful, and attentive mom and spouse. Now, I came from North Carolina, where I had my first 2 pregnancies, and I did not have access to these type of resources. I know that my story would look very different had I stayed in North Carolina, and this was my pathway to an entire community that I otherwise wouldn't have found. It is vital that Vermont families, especially new parents, receive this important lifeline of having an in-home nurse and access to these resources. It is important for legislation to understand that early intervention is the key to long-term success. Thank you.
Wow. Thanks so much to all of our panelists.
What an incredibly powerful panel of speakers. I want to, before we transition into closing remarks, make one connection between data, family, and expert experience, and the opportunity to create policy change. And so we are going to place a link in the chat to the 2024 policy playbook, so you can learn more about the SAC recommendations and all of the different strategies to support families in the perinatal period, namely around dulce and doula services, specifically to this area of work. So first, I want to say thank you so much to Ilisa Stalberg, JennRose, and Amy for joining us today. I think what was most important for me is that sharing your experience about the work is what makes it real. It helps us understand the needs and challenges in a way that the numbers and the data alone really can't. I also want to thank National Life, our corporate sponsor, for the publication of the report, as well as the state of Vermont and many of our private philanthropic funders who support this work. In closing, let's reflect on the state of Vermont's children as we enter 2024. You have heard some staggering statistics on the significant increases in the number of children with emotional and mental health conditions, a striking increase in the number of homeless children, high rates of substance use in pregnancy, and concerning rates of exclusionary discipline and literacy. What's exciting is that the data shows us what challenges to prioritize for the coming year, and what we choose to prioritize indicates what we value most. So as you walk away from today's briefing, I want you to feel empowered to use this data to create change for kids and families in our system. We've made tremendous progress in improving transparency and accountability by making data meaningful and publicly available. And now it's our collective responsibility to use it to make change for our children.